Well, another thing we're talking about today is the Centre of Excellence. Now, I gave you a little bit of a sneak preview of that yesterday, and I'm very excited to introduce you now to the Chief Medical Officer here at American Hospital Dubai, someone who's been working hard on the Centre of Excellence. It is Dr. Tariq Dufan. Doctor, thank you so much for your time. I have to say, you must have had a very busy 18 months given the state of the international health system these days. Not only have you been handling the COVID pandemic, you've also been working on the Centre of Excellence. So take me through, what does that mean in real terms for the everyday person watching today? What is the Centre of Excellence and why is it so important?
So that's a very good point. Yes, we were battling with COVID for the last 18 months. Now it's the second wave and we're going possibly to deal with the third wave. But that's it translated to more concentration about what we will do in the future and what's the need of non-COVID patients. And that's what translates to a Center of Excellence. So the strategic plan of the American Hospital is to invest more in the Center of Excellence. Those Center of Excellence, they will improve the quality of care of the patient. They will provide a high level of quality of care that's high standard, that's a Western standard, American or European, within the Emirates of Dubai. So patients will not need to travel. This Center of Excellence will reflect in terms of the efficiency, in terms of the treatment way, in terms of the outcome of those patients. And we concentrate on three Center of Excellence: the Oncology, the Cardiology, which is the heart center, and also the orthopedic, because of the need that we need it not only in the American hospital, but in the whole region of UAE and the Gulf area.
What are some tangible examples you can give me of the changes that we're likely to see? Because I think when it comes to American Hospital, it's always been a very high standard of service. So when you talk about improving patients' experience, what does that really mean? What are some ways they will see changes?
This is very important. I will take an example for the Oncology Cancer Center, or the Cancer Care Center of Excellence. Right now, the American hospitals see one of the biggest private hospitals that treat cancer. Cancer, as everybody know, it's not on a one-man show. It's a teamwork. So you need to have the surgeon, the medical oncology, the radiation oncology, the nurse, the social worker. You need to have the technology. You need to have the latest ICU, the latest equipment to have and deliver those high efficacy, high quality care. And that's exactly what we are doing right now with the Cancer Center. The American Hospital will invest in a whole building, separate building with the Cancer Center, that including first investment in terms of the equipment with the radiotherapy. They will have a new department of radiotherapy with 4 machines that have the latest technology. The medical oncology would having the latest medication in terms of immune therapy, targeted therapy. And the latest one is actually the surgical oncology, because one of the problems now, people go abroad because of the surgery. Now we have many of our surgical oncology that have been here and coming here. On top of that, it will open a window for a research, and that's it will attract a high quality physicians from abroad. Those are an academic one. They will come when they see the quality of the care that we provide.
So do you think we're then going to potentially see a boost in medical tourism here? The fact that more people are going to be staying here to be treated, but maybe more people are, visiting from the region or internationally, and really establishing Dubai as that hub of medical tourism, something, the UAE government has certainly been including in their vision as well.
This is an excellent question, and this is the vision of the American Hospital. The American Hospital do not look for Dubai market alone. It's actually we concentrate more on the international region. We already identified the area of priority 1, 2, 3 zoning. That's important for us, and to try to make American Hospital or Dubai in general as a hub for tourism, medical tourism. And actually this is it will be happening with a collaboration with the DHA, Dubai Health Authority, and with the government. We already have some proposal giving, and this is very important, because when you have the whole area, the whole city as a medical tourism, because as you know, medical tourism, they are not all from rich country, they are different level of economy. So you need to have a provided every level with the care they can afford, but it needs to be a high quality, affordable care. So this is the goal, and this is the vision of the American hospitals.
Absolutely. It should be healthcare for everyone, not just the rich, isn't it? Now, I know you have big expansion plans. You touched on them just briefly. I think you've got 7 clinics expanding as part of the Center of Excellence. What can we expect?
Yeah, so right now the American Hospital, within the last 2 years, we expanded, and we have a new strategy that will go to ward and an outreach clinic, which is have a more footprint closer to the patients than coming to the center of Dubai. So we started with Al Jumeirah, we started with the Dubai Media City Center, then we have the Al Barsha, then we have now expanding to Al Jumeirah 1, which is in Galleria Mall, in Al Wasl Street. Also, we have open Al Khawanij Clinic, which is the last exit. We have another one coming in Dubai Hills, which is coming in the last quarter of this year. Another one coming in Al Mira area, which is, it will be on December this year. And the good one, which is the big one, it will be in Nada Shiba area, which it will be in the quarter 1 2021. The goal is not to have those clinic as a family physician or pediatric or something basic. No, no, no. It will be a standalone multi-speciality center that will be separated from the American hospital as an entity, because they become like an 8 or 9 clinic, and those will be having the backup of the American hospital expertise if they need.
And making it more accessible across Dubai and the region.
It will be more accessible than the American hospital for many other levels of the insurance in the communities.
Oh, it's a really exciting time to be working with the hospital. Dr. Tariq, thank you so much for your time. We really appreciate it. Congratulations.
Thank you.
Thank you.